Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
My first guest to start off this evening is Dr. Matt Shane, who is a general surgeon with Baptist Health. Welcome. Thanks for coming in.
Thanks for having me.
Well, tell us. I'm a family doctor, do a lot of stuff. You're a general surgeon, does a lot of stuff. We got an orthopedic surgeon, does bones, ophthalmology, does eyes. We've got all kind of specialty surgeons, but tell me what a general surgeon does.
Sure. Well, a general surgeon is a medical doctor that specializes in the treatment of disease that require operations or surgery of some kind. And that can be a wide variety of things, really all over the body, including things like thyroid disease, gallbladder or appendix, hernias or other things like that, all the way up to breast cancers, colon cancers, and other GI-related malignancies.
So you're kind of like a family doctor with a knife, is what I say. But you do a lot of stuff, and one of the things that you deal with is abdominal pain. Now, there's a lot of stuff in your abdomen.
There is indeed.
Yeah. So how do you know when abdominal pain is something you worry about?
Well, sometimes it can help to have kind of a stepwise approach to some of those kind of things. In other words, certainly all of us at certain times get various upset stomach or what have you. And if it's usually self-limited, goes away after a couple hours, usually not a big deal. But if you begin having pain that's well out of proportion to what you're used to having after, say, a spicy meal or something like that, if it persists for several hours or even gets worse, and especially if you start seeing things associated with that, like things like fever, nausea or vomiting, or difficulty having normal bowel function, or if your abdomen suddenly feels very, very tight, and anytime you touch it at all or even sit or move a certain way, it produces a lot of severe pain, that may be a time to seek better care.
Now, when you see somebody, there's a lot of diseases, like I say, a lot of things in the abdomen. What are some of the things you see and treat?
Well, there's a whole variety of things, as you said, because there's so many organs within the abdomen itself looking at that area. One of the most common we treat is gallbladder disease.
Now, gallstones, what are they, and what are some typical symptoms of that?
Sure. So the gallbladder is an organ that sits just underneath your liver in the right upper quadrant of the abdomen. In other words, right underneath kind of your rib cage on that right side. And one of the things the liver does there is make bile. Now, bile helps us to digest fatty foods. The gallbladder's job is to store that bile and concentrate it, make it more effective, so that when you eat, that gallbladder can then squeeze that bile into the small intestines where it mixes with our food and helps us to digest fatty foods. Now, sometimes we can form stones in the gallbladder, and those stones can act kind of like a ball valve, if you will. In other words, the gallbladder is squeezing to push things through the bile ducts, but the stone blocks that outflow of bile, and that can cause pain, nausea, vomiting, sometimes fevers or chills as well.
Okay. Now, you mentioned right upper quadrant. Right lower quadrant is appendicitis. You deal with that also.
Correct. The appendix is a different organ, but it's attached to the colon down the right lower quadrant. And for years we thought the appendix really didn't do much, but in actuality it probably plays a role somewhat in our gut immunologic response. But your appendix can get very, very sore or get blocked itself and become inflamed acutely, and that can cause appendicitis. And that requires a surgical fix.
Well, you know, I mentioned you do a lot of stuff, and you do, and I appreciate all you do. We'll maybe have you back where we can go through some other organs.
Oh, absolutely. We could fill your entire show, I'm sure, with stuff that we do as general surgeons.
Thank you for the care you give your patients.
Thank you for having me.
All right. We'll be right back.